Hello friends, Keto ND Dr. G. I am going to attempt to record a video on an update for primarily COVID-19 and where I see things as from my perspective as I've followed this for the last few months, like many of you. I want to talk a little bit about, I've got some kind of an outline set up here and I'm going to go through these topics. So I want to talk about herd immunity versus isolation. Government control versus freedom. I'll try to stay out of the politics somewhat, but this obviously is what is most on many of our minds, and so I'll talk about that. This pertains to the use of masks as is being increasingly recommended, and I'll talk about germophobia and probiotics, and then a little bit on vaccines. So I've been doing some posts, and I've had a newsletter recently where I've been discussing some of these topics, but I want to do a quick summary and then I'll get into these topics a little more in depth. So first off, is kind of a review. If you've been keeping up with the science of this, we know the COVID virus is a novel coronavirus, the COVID-19. We know that the primary receptor site in the lungs and in other tissues is the ACE2 receptor in lung cells. And this ACE2 receptor and enzymatic molecule. This is a molecule that takes some substances in the body. We refer to it as ACE and ACE2, angiotensin converting enzyme. This is doing a lot of things in the body, but primarily it controls blood pressure. It does regulate some of the inflammatory response, blood sugar, etc. And so the ramifications of COVID, and so your risk factors for a worse disease outcome from it, and also the things you can do to help protect yourself are very relevant. And so I don't want to talk about this like it's just interesting science. A lot of times, we can go years and years where we're continually studying, and then what actually gets released into sort of our public forum for treatment options honestly don't ever get there. And so I think it's relevant that you understand some of this and it's empowering to you. So a couple of things that have come up. So those comorbidities that increase your risk for disease, and especially from a negative outcome of let's say the risk of dying from COVID-19, has to do with these principles. We know that things like hypertension, high blood sugar, diabetes, obesity, high stress, and of course aging, those all relate to a worse outcome, and it has to do with this activity of the ACE2 receptor and enzyme. So in this diagram I have lung cells, and I'm showing the COVID virus. It likes to attach to this ACE2 receptor. What I've been able to see in the research is that the individuals who have low circulating ACE2 are more at risk because ACE2 in circulation helps bind up and block the virus itself. It also, the ACE2 itself actually lowers the risk of those comorbidities, and so you're less likely to have this inflammatory cascade, and I'll talk about that in a second. And so again, just to review, high sugar, high blood sugar, so high sugar, high carb diet, obesity, high stress, having high blood pressure, high levels of aldosterone, and high cortisol levels can promote this ACE side, which increases your risk of problems. Ketones, so intermittent fasting or high-fat, low-carb diets, exercise, vitamin D and zinc, just a few things to mention that help promote ACE2. And it's very relevant for treatment that we work on those risk factors that we can all have. Another thing, so deep breathing, cold therapies. This is that contrast cold therapy I've talked about with Wim Hof, etc. So those are important attributes here. Now we're to this point where we're starting to see people able to go back to normal life again to some degree, and we're talking now more about vaccines and herd immunity versus isolation. And I want to just emphasize a couple of points. One is that isolation decreases your immune system. Isolation increases your risk of dying of a number of different causes. And it's not just about, depression and suicide. This is about nearly every chronic degenerative disease. You see these very high increases in those that are isolated for extended periods of time. So I think it's vital that people get out and we return to some normal parts of our society, and that's happening, thankfully. But now we're seeing a lot of these additional restrictions that are in place, and I don't think there's, I think there's some steps that are unfortunately not helpful. We shouldn't demand that our government keep us safe in every scenario. And honestly, this word of being safe is so overused right now that what does this even mean? If we think that it's our government's job to keep us safe, we won't have much of a society that I would want to live in. All right. So it's just, again, this is my opinion. And so the more safe we think we're being kept by our government, the less freedom that we're going to have. And I think that's what we're looking at. And unfortunately, there's a part of there's a philosophy that thinks that government has the answer for all of our problems. And I don't see any track record for that. And I'm not advocating for anarchy and that we don't have a government, but I think it needs to support those constitutional rights that we all have to maximize the health while we take care of the vulnerable people. And I think it's just so unprecedented that it doesn't make, in my opinion, medical sense that you, instead of applying a targeted approach that we protect the vulnerable, we look at the science in terms of who's vulnerable and we help those people. And we don't need to mass shelter in place and to keep going into these extreme measures to try to control the virus. It has to come through the natural immunity that will develop through people being exposed to these things. So I think I've talked about this before, but the nocebo effect, nocebo is the counterpart to the placebo effect. And so this, something that I do know, I think I talked about this before, but again, this narrative in the media that keeps promoting fear and this idea that we need to be kept safe by these forces that regulate us, our government, etc., and these more regulations, more rules. This nocebo effect can increase disease by up to 30%. So, in studies, and again, that's not relevant. It's placebo. The placebo effect works, and so does the nocebo. And so let me explain that a little bit better. When you believe that something's going to harm you, whether that's real or not, your beliefs will actually manifest in your body and in the outcome of your health. And so, and this has been documented, it's very clear that both if you convince people that you're going to give them something or you're doing something that's going to make you better, it actually will make you better, whether there's any identifiable cause and effect. You know, again, the placebo pill. The placebo pill, that is a sugar pill or something that does nothing, that we know clinically can help you. If you convince someone that's the case, it will. This is the whole thing of mind over the power of the mind over the human body. And so it's vital that I think in just terms of our health that we're constantly, or we're continuing to nourish our thoughts and beliefs and what we think of ourselves. And this involves a lot that I won't go into today, but it, you know, our practices in terms of meditation, journaling, exercise, etc., our spiritual life, those all are very, very important. And on the counterpart, the flip side of that is that if, you believe that something, you were in imminent danger, you know, you can't live for months with the belief that we're all vulnerable to die at any point from an infection like this. This whole thing has been, and I said this, other people said this, obviously, you know, I've had some training in infectious diseases. I've been practicing for many, going on 15 years here. When you convince people that they're in danger and you keep that narrative drumbeat going, we are causing so much harm from just that posture, that attitude, that narrative. And again, I'm so tired of hearing the narrative of, even it rolls off the tongue now. I don't know if you've had conversations on the phone with businesses or colleagues or friends, and it's like, oh, be safe out there. It's like, stay home, stay safe. What does that even mean anymore? Of course, let's stay safe. Wear your seatbelt, exercise, eat your vegetables, go to bed on time. But now we've gotten to the point where you can't even function in a normal way without supposedly being having a threat on yourself or your family. This is just not the data, and what's happening in our societies right now. That's not the case. It's just not. There's no science that's verifying that we need to be in this state of panic. I hope that's clear. I think I'll put that aside now. So let me talk about masks, because I've been back and forth on this topic, so I'll try to be as concise and to summarize where I'm at with it. The science on the use of masks to protect you against infectious diseases is verifiable. That is why when you go to the hospital, if you're having surgery, if we're dealing with an epidemic or somebody or anything with an infectious disease, depending on what we think it is or what the disease is itself, we're going to have the healthcare providers wearing protective devices, respirators, N95 masks. You've got the surgical mask. There's all kinds of PPE that's used appropriately. When we exercise correct usage of hygiene and PPE, personal protection equipment, we can minimize the transference and the spread of infectious diseases. So there's no controversy about that. The key, though, is that it's using it correctly. There has never been a situation it's never been studied in the mass population to show a benefit by everybody wearing masks. So I want to say that right out. There is evidence within some outside medical community studies where they looked at careful hand washing and mask usage did show a small decrease in infection rates. But as far as everybody just going around their business and always wearing masks in stores and elsewhere, somebody show me the data. I don't see any data that shows that's even beneficial at all. In fact, as I'm going to point out, there's a lot of evidence, some very well done studies, and some basic, if you think about it, it should be common sense if we think about the way our bodies work and how we breathe. And that is wearing a mask all the time, not in a medical setting, but if you wear a mask a lot of the time, you can increase your risk for a number of problems. Number one is oxygenation. So oxygen, you have to be able to breathe in oxygen and exhale carbon dioxide. And so there was a study that was done in 2008 with surgeons that showed how much your blood oxygen level will drop with having just a surgical mask on, and it was significant. Okay, so they showed that in this 2008 study that the blood oxygenation dropped. It was time dependent. So the longer you wear a mask, the worse it was. It meant low oxygen saturation and an increase in your pulse. So it was a significant and statistically significant finding. This was using just regular surgical masks. And that is why when a doctor, a surgeon does his work, he's wearing the mask, and when he's done, they take it off. Okay, you don't go around wearing a mask all the time. It's also been shown in the usage of the N95, which is even more restrictive, that oxygen saturation dropped by as much as 20%. There's even cases where people have lost consciousness. It's lowered the oxygen so much. So it makes sense. You put something in front of your mouth, it's going to impede the oxygen getting to your lungs and cells and also raise your carbon dioxide. So it not only caused, and we call low oxygen levels hypoxia, and then on the flip side it caused hypercapnia or high carbon dioxide levels. It increased headaches by 80% in a study in medical workers with the use of N95 masks. This is a side note, but it's also been shown, as you may have heard, that the use of ventilators for the COVID-19 infections has a very high mortality rate. So those that end up getting ventilators, and what is that doing? Well, it's trying to force oxygen into those people's lungs who have poor ability to assimilate that oxygen. That maybe it's a slightly different topic. We don't fully understand that why, but the these people have this immune compromise where they have this inflammatory response and they have an impaired ability to exchange oxygen, and so forcing it in probably raises the oxidative or the damaging effects of their problem already. And so the point is that those people with those comorbidities, when you have them wearing masks all the time, you're causing more hypoxia, you're causing more elevation in carbon dioxide, you're also at risk of increasing problems health-wise. So also there's evidence, studies show that a decrease in oxygen levels, this hypoxia, causes impaired immunity. The people who need the strongest immune systems, of course, we've got them wearing masks all the time, they're going to lower potentially their immune system. The other part of this that's very concerning to me is that when you wear a mask, you are more likely to recirculate viral particles. And so if you get a virus in, let's say you don't have a mask on or you're exposed at some point, and obviously we know the virus can get around the masks and in. As you begin to breathe through the mask, these viral particles, if you have viral replication and shedding, you are going to be rebreathing and raising your your viral count much more quickly than if you just were exhaling and getting rid of that virus. And so this is a big concern. You know, this virus replicates in the nasal passages in the lungs, and you're simply concentrating it in there. So, by the way, those people wearing masks, I've seen a majority of them they aren't wearing it properly. They're pulling it down, they're touching it, so they're touching their face, their mask, way more than if they weren't wearing a mask at all. And so I think it's actually increasing the risk of touching, recontaminating, getting the virus in, if the virus is even in their vicinity. Another note is that this virus, we know it attacks the ACE2 receptor, and we now know that there are ACE2 receptors in the brain, and there's a close connection between the olfactory passages, the olfactory nerves that can get viral particles up into the brain. And so if you're recirculating this virus right on your face by holding a mask on all the time, you're more likely. Again, this is all evidence that we know from other studies. We won't know for maybe years and years really what this outcome will be from various actions. But I want to point out this evidence and to say that we need to just, sometimes your public health department, unfortunately, is telling us to all do stuff that I don't think they've evaluated the bulk of evidence and what we need to do. And if we tell everybody to do something, there may be many of us who would have side effects from it. And if you remember, just the end of February, our Surgeon General said, literally, quote, "Seriously, stop buying masks. They are not effective in preventing the general public from catching the coronavirus. They're for healthcare." And again, I'm not saying masks don't work. PPE are for use in those circumstances for moments in time when you need to care for people who are sick. They are not intended to be used. In fact, there's no studies that were demonstrated. The manufacturers even say this. They are not made to be used for the general public going about their business. All right, where else? So germophobia versus probiotics. So this has always been a dilemma, that we live in this world of overuse of antibiotics and everybody thinks they're going to die from dirty hands, right? This is a fine line between common sense and hygiene and allowing our bodies to be exposed to the good bacteria that we have. I would just suggest that we use antibiotics very judiciously, and that we make sure that we have healthy bacteria in and on our bodies, and that's done through a good diet and also through some protocols. If you suffer from chronic gastrointestinal problems or you're getting sick all the time, there is likely an imbalance with probiotics, the good bacteria that needs to be in your body. You need to minimize the use of medications that disrupt that. Again, they're overused. Antacids, corticosteroids, NSAIDs, Tylenol, ibuprofen, and of course antibiotics. We need to minimize their usage and save them for those cases when we don't have any other options. So let me talk about the inflammasome really quick, because I don't want this video to go on and on and on. And this is something that is fascinating to me, and I think what's important is the takeaways that I'll cover here. Those that have, by the way, this is very relevant for just chronic inflammation and a lot of diseases, cancer, heart disease, autoimmune diseases, arthritis. They involve an inflammatory process that's gone awry and is going too extreme. In the case of COVID-19, when individuals suffer the acute respiratory distress syndrome, or those that have died from the disease, we know that there is this cytochrome storm. It's essentially an immune system function gone crazy. It's gone awry. It's gone to excess. The NLRP3, I won't give you what those all stand for. It's a long word that represents the studied inflammasome pathway. So let me back up and just explain what this is. In our bodies, our immune system is designed to react to an assault or an impact for some reason. So if you fall and get injured, if you get an infection, your immune system will react, the body reacts to begin to defend and to restore equilibrium in the body. And so the inflammasome or cytochrome storm involving this NLRP signaler is this process where, and I've drawn down here, I think you can see in this video, here is the cell wall, so I'm giving you a cell, here's a barrier, we could say this was within the lung, and we've got, I just drew in the ACE2 receptor to kind of compare up there, but this virus is our assaulting agent, so it comes in, it hits receptors on the cell top here that both cause the infection, but also signal the immune system. This TLR4 receptor is one of the places that signals the immune system through NF-kappa beta. The nucleus of the cell begins to make these cytokines, these interleukins that are released. And over here, what they do, and why is this happening? Well, this is the phone call to the immune system. Hey, we've got a problem here. We've got a virus. We've got damage happening, we need help. And so these cytokines that are released call for more immune cells to come and help fight this battle. And so we've got T and lymphocytes and B cells, we've got the production of antibodies, we've got macrophages, large white blood cells that come and devour and sort of do the cleanup process. This is all normal. The problem is that when we have over-amplification or unregulation of this NLRP pathway, this goes unchecked. And so what I'm drawing here is I'm showing these, this by the way is the cell wall, and you've got the breakdown, but basically it literally begins to disrupt the integrity of the cell wall, and you have water, fluid coming in. That triggers more inflammation. You've got, again, unregulated inflammation, water and fluid. If you hear about the COVID-19 infections where there's ARDS and the lung, pneumonia and all that, we've got this influx of an over response going on, fluid, swelling, inflammation, and it just goes on in a vicious cycle. So all that background, NLRP3, I started looking at the research and what came up. Fascinating, because there's some things that we can do about that. Turns out that melatonin has been studied. In fact, they looked at the SARS, the first SARS-CoV virus even, and had studied this, and melatonin's been studied quite a bit. We know that it downregulates the NLRP, turns out. Of course, it does other things. It's not necessarily something everybody needs, but in those people who we know have sleep issues, I highly recommend that you get your melatonin level tested. It's a simple test to do that. And it's a simple therapy to be able to take additional melatonin if needed, but it's clear that NLRP3 is reduced. So number 2, studies came up, and I posted this recently on Facebook, was that a study actually showed that beta hydroxybutyrate, or the primary ketone that we generate when we either supplement with BHB or we have a low carbohydrate diet, also exercises and a healthy sleep raises beta hydroxybutyrate. Guess what? It regulates decreasing NLRP3. We also know that the ketogenic diet and ketones are very anti-inflammatory, and we know at least one of those pathways, of course, right here. It's going to down-regulate this NLRP activation. Another study, vitamin C, especially with quercetin or flavonoids, and I've talked about vitamin C a lot, and it's absolutely vital that we get enough vitamin C, but it's in the context of the other micronutrients that I've talked about, especially vitamin E, by the way. There's a synergy between things like vitamin C and vitamin E, selenium, alpha lipoic acid. These are regulating the inflammatory, not just the inflammatory, but this antioxidant redox that happens with free radical generation. And so it's a vital part of the body. So I'll leave it at that. And finally, vitamin D, also the vitamin D receptor and vitamin D levels are associated with regulating that inflammatory process as well. So some key lifestyle and nutrients to be aware of. And then things we don't want to promote are things like high cortisol, high stress. A lot of people who died of COVID-19 infections in the ARDS, they had high cortisol levels. We know that low estrogen is associated with problems, and in my practice, I've actually seen epidemic levels of low estrogen, premenopausal, postmenopausal, and honestly, on the flip side, in men, low testosterone increases your risk of many, many other problems related to the immune system, and that's also quite common. And lastly, sugar, of course. Having high blood sugar due to a problem with your metabolism, and it's tied usually to diet too, but many people can start to even eat well, but they have a hormone regulation problem that needs to be addressed. So bad, good over here. All right, so vitamin E, I'll leave that for another topic, but I guess I will just say vitamin E, it's important that these are in the right form. Okay, vitamin E is not one thing, and most multivitamins actually have a single isolate of vitamin E that's not the active vitamin E that we need, the full complex. And so you want these, it's a blend of like 6 different compounds, these tocopherols. They're found in food and in better quality multivitamins. It should say mixed tocopherols and tocotrienols. The seed oils especially, but rice bran, annatto, flax, nuts like walnut and hazelnut, and especially helpful in the context of vitamin C, which is essential as well. So let's see. Very antioxidant that we have that whole complex going for us with our diets. Vaccines. So probably going to save vaccines in depth for another time, but I want to say that it's odd to me that, well, it's not odd, it's to be expected that we have now this big push that the world is waiting for the vaccine so we can get back to normal. And I said originally, based on the studies I looked at, it's going to be very difficult to have a vaccine that's going to work effectively enough against this virus in time to really be relevant, but also that, I mean, if you look at the flu virus vaccine, right, what do they say? Even at the percentage of people who are getting it, there's only 5 to 10% effect in any season. You've got mutations of virus, you've got where the vaccines would have to constantly be keeping up with that. I also, and this is something I've been watching, I've been studying vaccines for the last 20 years to watch what's coming out. I work in clinical practice where I work with those people who've suffered the very much traceable side effects to vaccines. And unfortunately, if you don't tout them as the cure-all, save-all, savior of the world, you're vilified, this anti-vaxxer, terminology. That's simply used to, that is when people don't want to engage in a scientific and a credible discussion. Instead, they want to minimize people in that category. Am I totally against vaccines? I think they have a relevance. We need to keep looking in we need to have clear availability of the research. We need to do real good research, and unfortunately, they just throw them out there. The research is actually done on people in real time. It's very difficult to track exactly what's happening in terms of side effects because of limitations in the reporting of them. There is real data that shows that vaccines have there's a potential for contamination with other antigens and particles that can trigger the immune system and trigger autoimmune diseases. There are viruses that are carried along that aren't expected or aren't detected that are in these vaccines that are given. And we don't always know. They're using various tissues from other organisms that often have things in them, other viral particles and actual viruses themselves that are potentially introduced into the body. And when you trigger the immune system with vaccines, there are sometimes unintended consequences. And as is true with the actual virus itself, I get that. And so people will often say, well, it's safer to give people the vaccines because the virus particles in the vaccines have been attenuated, or they're not actually going to cause the infection. But it's a fine line, because the point of a vaccine is to trigger the immune system to react, to make antibodies and protective factors. And again, because of contaminants, because of preservatives, because of the antigens themselves, when you introduce them straight in through the skin into the bloodstream, you can have all kinds of pro-inflammatory effects that are unintended. And the very vulnerable, of course, are young kids who have some compromises. They begin to come into the world already, depending on the age. And ironically, the people who need the vaccines the most to be protected are the ones most at risk to the side effects of vaccines because of immune problems already. And so these are the elderly with comorbidities, and these are the very young children. And so anyway, it's an ongoing debate, and I just will leave it at that for now and just say that in the meantime, hopefully we may have a perfect, safe vaccine. I pray for that. But again, the track record of how industry and our government and the professionals who promote them don't have a good track record when we look at some of the evidence. So I just would be cautious. And in my opinion, I think it's unethical that we ever mandate. These are our bodies. It's our bodies, our choice. If we want to use that mantra that's overused, unfortunately. We all should have choice in our healthcare decisions, and it should be an educated choice. And I pray that they don't ever mandate and take away our freedoms regarding our health. And so I'm going to call that a wrap for now. I will put this video, ask questions, clarifications. I will put up some links probably to some documentation in terms of references. And I hope that you take some of this to heart and continue to live a worry-free life, which is impossible, but let's not have unnecessary worry about things that, things are getting better, and they have been getting better for much of this time, and we should get back to taking care of ourselves and our loved ones. So I'll see you in the next video.